people with histories of trauma also are more susceptible to colds and bacterial infections and cancer. We still treat cancer. We don't tell someone with bacterial pneumonia to go process their trauma. And it does not mean that brain-based treatments are the only and best treatment for you. What are the odds a person could have all these different problems and just have them? At the time, I had digestive problems, migraines, vulvodynia, interstitial cystitis. I had a history of back pain in my chart and sinus infections and sinus surgery and endometriosis surgery. And he said to me, like, look at all these things. It's crazy that one person could have so many problems. Therefore, none of them are real, and you just need to read John Sarno. So that literally happened to me, and that doctor was completely wrong. There are multiple other explanations. Even if stress is part of why some of these things developed, it is possible that a person could have an underlying root cause such as Ehlers-Danlos syndrome, or an autoimmune disease, or a pathogen, or perhaps in my case, a medication or two that they've been told to be on is actually causing a lot of the problems. It's possible for a person to have one root cause causing multiple body system problems. It's possible for a person to have two problems that are causing multiple different problems that are all physical and that require physical treatment to actually get resolved. Why am I going off on this? Earlier this week, I saw this post made by Claudia Morandi. It's an email from a doctor named Mark Edward Baba, who's basically saying and doing the same thing to some chronic patient that was done to me 10 years ago. He just doesn't even examine this patient, just says, I see that you have many different pain syndromes. Whenever we see this, there is a very high likelihood of some significant personal, emotional, or physical or sexual trauma. So already that's just so effing problematic. Just to assume that a person with pain syndromes, a large portion of the population has personal, emotional, physical, or sexual trauma at some point in their life. He then goes on to say that it's always preferable to address past trauma, and that is the ultimate cure for the pain. Okay, there is no actual scientific medical evidence that, there's actually not really evidence that trauma can be addressed in a way that cures people of physical conditions. Even the phrase processing trauma, like what does that mean quantifiably? When is someone's trauma officially processed? What exactly does a person have to do to get the green check mark, like trauma processed? Is it a certain number of hours of cognitive behavioral therapy? Is it a certain number of sessions of EMDR? Is it a certain number of days of meditation and yoga? A certain number of pages of journaling about your trauma that you have to do? We don't have answers for this. This is not medical science. They're good ideas. These can help people. They certainly have helped me with my mental processing of trauma that I've had. But there is no erasure of these things that ever happens, and no amount of psychological based therapies have ever addressed any of my physical issues, because my physical issues have always had physical causes. And yet, just like that poor patient, I've been told that my problems, because I have multiple problems, because I had multiple problems, because I have chronic diagnoses, because I have diagnoses that are visibly underfunded, verifiably stigmatized, that it can't reflect anything physiologically wrong in my body, and it must be something in my brain. Okay, Ehlers-Danlos syndrome is a connective tissue disorder where the body makes faulty collagen. I've been hypermobile since I was 6 or more. My thumb used to pop out of its joint when I was 5. I had to wear a brace. I have an extra ankle bone. My feet roll in. My ankles are unstable. My feet are fallen arches. I have knee pronation. I know for a fact that has caused me major knee pain and back pain, and that targeting those areas has improved my knee and back pain. At the time when I saw this neurologist who told me that all my issues were in my head and that there was no point even examining me, I was taking a high estrogen, a birth control pill that was causing the migraines, which were the reason that I was in his office. A lot of the other conditions on the list that he told me made him think that it was all in my head were also problems caused for me by being on the birth control pill. And the other problems on that list were problems that are common in patients with Ehlers-Danlos syndrome and hypermobility. So all these different issues that I had were explainable by two different situations, Ehlers-Danlos syndrome, and my long 15 years on first the low dose and then the high dose estrogen pill, birth control pill. So what are the odds that a person could have so many different chronic pain syndromes? Well, pretty damn good, considering that the medical establishment has been proven to not take women's pain seriously and has not researched our medical conditions and has not developed good diagnostic screening tools to properly diagnose people, and doesn't treat people in the first place when they have issues like I had with like a simple yeast infection, a simple UTI, and then recurring UTIs, and then recurring yeast, and the use of very irritating medications that may have worsened my vestibulodynia, and years of atrophy that caused my clitoral hood to adhere to my glands, which required me to have a surgery, which left me in excruciating pain on my right side, at a time when I had resolved my other chronic health issues and was living a normal, abled life. So even years after all the syndromes that could only have been in my head but were really caused by physical things had resolved, there were still lasting problems that no doctors diagnosed. I was also still suffering from low testosterone. I think I spent my entire adult life with very, very, very low testosterone. Testosterone, just Google it. Google testosterone and pain. Testosterone has a huge impact on the way we perceive pain, both in males and females. Sex hormones, steroid hormones in general, both have a lot of implications in GABA signaling, in all kinds of pain perception and disease processes. They really affect the immune system too. They affect mucosal tissue. Testosterone affects the way the glands in the vulvar vestibule function. And I had vestibulodynia. And I had bladder pain, and the vestibule is made from the same tissue as the urethra and the bladder. I mean, I can go on and on with the specific concrete physical issues that I had that dozens upon dozens of doctors didn't know about and didn't care about, and were all more than happy to just tell me it was all in my head, which is why I get so upset when I see posts like the one Claudia Morandi made with that doctor who did what Dr. Delamotte did to me in 2014.